We're emergency and preparedness. We really do so many other things. We work with hospitals and EMS to make our region safer.
So Hurricane Gustav saw about 300 ambulances and 1,000 buses.
I guess after the first storm, we sent them all home. By Monday, the next storm had come in and we had to call them all back. And that was the way we used MER 3 to do that.
On the coattails of Hurricane Gustav came Hurricane Ike. And when you're looking at 500 ambulances and 200 paratransit vehicles and another 100 buses, we're looking at somewhere in the neighborhood of 1,500 responders that we're going to need to get a hold of when it's time to send them out the door. So we're primarily using cell phone notification for the ambulance response during the hurricanes. But on a day-to-day basis, we hit a number, whether they be one-way pagers, two-way pagers, email, Blackberries, and cell phones.
It would take hours to call reps from 53 hospitals to let them know what was going on. With MER 3, it took me maybe 5 minutes, and that was with logging in.
Making 25 calls to 25 different paramedics on 25 different trucks is time-consuming. That alone would have taken us half hour to an hour to notify that many people without that system. Instead, we were able to send that notification out in 2 to 3 minutes.
During Hurricane Ike, we have one of our sister hospitals that's located on the coast of Texas. And we were able to very quickly notify the management staff within our hospital when the hurricane struck, and we began preparation to receive those patients from our sister hospital.
STRAC is kind of the enterprise level user. We can give certain permissions to healthcare facilities, for example. So a hospital can have access to all of its personnel, but we as the enterprise level administrators have access to all of them. The folks at one hospital will maintain all their own contacts, and we use their updated information times 50 to reach out and touch everybody across the region. All the work's being done by the end user to maintain their people, maintain their information, and we're benefiting from it. That's huge for us.
I think my favorite feature is just simply the ease of use. Within the matter of just very few minutes, we can develop a notification, send it out, and we can reach 1,200 employees in just a matter of a few minutes.
There are other products, similar mass notification systems, that are just cumbersome, and really you can't on the fly teach somebody how to use them. And since we are emergency oriented, we need something that is easy and fast to pick up.
During the hurricane response and during those types of responses, we were dealing with people that weren't from this area. So these are paramedics from Massachusetts and Alabama and Colorado and California. So what we did was we grabbed some paramedics and some local administrative folks with the health department, within STRAC, within some of the local fire departments that volunteer with us and are on our emergency operations team. We grabbed those guys and trained them quickly on how to use the system.
It was very easy. And that's, I think, why we do training so often, not because people need more training. It's different people every time. So they come for a couple of hours and they're experts.
We're very pleased with the MER 3 system. It's cut our workload down tremendously. It's allowed us to move away from people sitting in front of phones to get answers to simple questions, and allowed us to branch out and do other things to help us prepare for disasters and just even day-to-day operations.